Madam President, it was about a month ago that the House of Representatives, by a narrow vote, voted to repeal the Affordable Care Act and to replace it with their own creation. That effort by the House of Representatives passed by, I believe, 2, 3, or 4 votes. It was very close, and it was a partisan roll call, all Republicans voting for it and no Democrats voting for it. So it came to the floor of the House without any bipartisan preparation. And it was only after the vote that the Congressional Budget Office took a look at the measure and reported to the American people its impact. Now that's unusual, because when you take a big issue like reform of America's healthcare system, historically, traditionally, members of the Congress, House and Senate, will send their versions of the bill to the Congressional Budget Office and ask for an analysis. Tell us how much this will cost. Tell us the impact on the deficit. Tell us what it will do in terms of health care coverage. But the House Republicans chose to vote before the analysis. Well, the analysis still came out. And when it came out, the report was unsettling because it had a dramatic negative impact on health care in America. The House Republican repeal, according to the Congressional Budget Office, would mean that 23 million Americans would lose their health insurance. Remember, we started this debate 6 or 7 years ago because we were concerned that too few Americans had health insurance. And we wanted to expand the reach of health insurance and make sure that it was good health insurance, and that's why we passed the Affordable Care Act. Now, we fell short in some respects, but we certainly achieved our goal of increasing the number of insured Americans with the Affordable Care Act. In my home state of Illinois, the percentage of those uninsured with health insurance was cut in half, in fact, even better than that. So more and more people ended up with coverage through Medicaid as well as through private health insurance. Now comes the repeal of the Affordable Care Act, and the Republicans in the House decide to not only erase all of that progress in providing more health insurance for more families, but to make it worse, to make the number of uninsured even higher than it was. And so if that's the starting point of health care reform, you ask yourself, is that really a worthy goal? Why would you do that? Well, they were forced to do it. They really were. The House Republicans really, in fairness to them, they had no choice, because they made the initial decision that their highest priority was to give a tax break of about $700 billion to the wealthiest people in America. So by creating this tax break, giving this money back to wealthy people, they took that same amount of money out of America's healthcare system. When you take $700 billion out of America's healthcare system, here's what happens. People who are currently receiving their health insurance through Medicaid, a government program, will have fewer and fewer opportunities to take advantage of Medicaid. In fact, they acknowledge that. The Republicans said in the House, we're just cutting back on Medicaid. Secondly, you reduce or eliminate the helping hand that we give to working families who can't afford to pay their hospitalization premiums. See, if you're in certain income categories, we give you a subsidy to pay for your premiums. So follow the logic. If you cut the taxes of $700 billion, take $700 billion out of the healthcare system, you have less money to provide Medicaid health insurance for those in low-income categories, and you have less money to help working families pay for their health insurance premiums. The Congressional Budget Office looked at that and said, and the net result, at the end of the day, 23 million Americans will lose their health insurance because of this decision by the Republican House. In the state of Illinois, a state of about 12.5 million people, 1 million people would lose their health insurance because of this action taken by the Republican House of Representatives. Well, from basic civics, you know that here we are in the Senate, and we get our chance once the House has acted. So we've been waiting for almost a month for the process to begin. And the sad reality is, it never even started. not the ordinary, open, public, transparent process of debating a change in America's public health system. Instead, Senator McConnell, the Republican leader, said, what I'm going to do is to take 13 of my male Republican senators, put them in a room, and let them write an alternative to the House bill. Why he didn't initially include the women in his caucus, he can explain. But it was 13 of the male Republicans who would sit in a room to write in secret their alternative. You think, well, most legislative ideas start with that kind of a meeting, closed-door meeting, in the quiet of a room, basic negotiation. But it's the nature of a democracy and our form of government that at some point this becomes public. Shouldn't it? If we're going to change the laws about health insurance, basic fundamental coverage of American families, shouldn't we know it? Shouldn't we know what the changes will be before we vote on them? Well, there's a pretty rampant rumor that tomorrow, for the first time, there'll be a limited disclosure of this Republican effort over the last several weeks. We are told, and it's only a rumor, that the Senate Republican leadership will sit down with the Senate Republican caucus and show them for the first time what they want to propose that we vote on. You might say, well, that sounds like the beginning of a good, long process. It's not. It's the beginning of a short process, because the Republican leader has said this time next week we will be into debating that issue and voting on it to its conclusion in 10 days. 10 days, start to finish, to rewrite the healthcare system of America. 10 days on a measure that has not been disclosed to the Republican senators, not all of them, let alone the Democratic senators, let alone the American people. And that's what we face with. When we wrote the Affordable Care Act, let me tell you that measure, which was widely criticized by the Republicans, let me tell you the process we followed with the Affordable Care Act. In 2009, the Senate Health Committee, Health, Education, and Labor Committee, held 13 public bipartisan hearings, 20 walkthroughs of various proposals, a markup in the committee that went on for 1 calendar month, and 160 amendments offered by the Republicans were adopted. 2009, Affordable Care Act. The Senate Finance Committee, that writes the tax laws, held 17 roundtables, summits, and hearings on the legislation, 13 member meetings and walkthroughs, 38 meetings and negotiations. Keep in mind, we still haven't seen the Republican proposal we're supposed to vote on next week, this secret proposal. The Senate Finance Committee on the Affordable Care Act held a 7-day markup and adopted 11 Republican amendments. At the end of the day, not a single Republican senator voted for the measure, but they offered amendments, and those amendments were debated, and many of them were adopted by the Democratic majority. When the bill, the Affordable Care Act, came to the floor of the Senate, we spent, and I remember this well, 25 consecutive days in session considering that bill. 25 days. What Senator McConnell and the Republicans will offer to us in what we call reconciliation, we'll be lucky to get 25 hours. We spent 25 days on this measure. In total, the Senate spent more than 160 hours on the Affordable Care Act, and more than 150 Republican amendments were adopted, though not a single Republican senator ended up voting for the bill. We opened it to their amendments and adopted their amendments. It was a bipartisan effort. What's been the process this time around? No hearings, no markups, no public input, no support from the medical advocacy community at all. I don't have a single medical advocacy group in Illinois that supports what the Republicans did in the House of Representatives. Not one. Hospitals, doctors, nurses, pediatricians, disease advocacy groups like cancer and heart, they're all opposed to what was done in the House of Representatives. And we're being told when it comes to the Senate's turn, get ready, it's going to be fast. Don't blink, you might miss it. Let me tell you what else we have. We have a record of quotations from leaders on the Republican side who, even though the Affordable Care Act went through all these hearings and all this deliberation, were very explicit in their criticism. Here's Majority Leader Mitch McConnell, Republican of Kentucky, in December of 2009 on the Affordable Care Act. He said, "This massive piece of legislation that seeks to restructure 1/6 of our economy is being written behind closed doors," Senator McConnell said, "without input from anyone, in an effort to jam it past not only the Senate but the American people." I might say to Senator McConnell, how would you explain what you're doing now when it comes to rewriting the health care system behind closed doors without input from anyone? Is it an effort, quote, to jam it past not only the Senate but the American people? Senator Marco Rubio last week was quoted as saying, "The Senate is not a place where you can just cook up something behind closed doors and rush it for a vote on the floor." I agree with Senator Rubio, but that's what they're trying to do. Senator Lisa Murkowski, Republican of Alaska, said, "If we had utilized the process that goes through a committee, I would be able to answer not only your questions, but my constituents' questions." Senator Murkowski, Republican of Alaska, expresses what most of us feel. How could we even answer an honest, legitimate question from someone we represent when we can't see the measure that's being produced by the Senate Republicans? Senator Jerry Moran, Republican of Kansas, said last month, quote, "I want the committees of jurisdiction to hold hearings. Bring the experts who know about health care from across the country. Bring the constituents to tell us their stories. Then I want every senator, all 100 of us, to have the chance to offer amendments." Thank you, Senator Moran. I agree with you. That is how the Senate is supposed to work, but that is not how it's working now. Let me tell you what some of the groups have said about this Republican effort to repeal the Affordable Care Act. You expect, oh, it's a partisan comment from a partisan senator. These are nonpartisan groups. The American Heart Association, what did they say? "The House bill would seriously erode pre-existing condition protections, including for patients suffering from cardiovascular disease." End of quote. About a third of us on Earth, or at least a third of us in America, have some pre-existing condition. For the longest time, insurance companies said if you're a woman, it's a pre-existing condition. Go figure. But now, at least a third of us have some condition which in the old days would disqualify us from insurance coverage or make it too expensive. So now we put in the Affordable Care Act a prohibition against discriminating against any American because they have a pre-existing medical condition. I think that's pretty important. My family has certainly got the same experience as other families when it comes to pre-existing conditions. Now the Republicans have said, we're going to take that out. We want to give you more choice. We want the insurance companies to have more choice. Choice means another reason to say no. Choice means coverage that isn't there when you need it. Choice means restrictions on your health insurance policy, which may not bother you at all today, but tomorrow when you go to that doctor for that diagnosis you'll never forget as long as you live, or get involved in that accident, and finally take a close look at that health insurance policy, you want to make sure it's there if you need it, don't you? The Republicans say we need more choice. Well, the American Heart Association says when it comes to pre-existing conditions that the House bill, the House Republican repeal bill, would seriously erode protection of Americans. The American Medical Association, the largest group of physicians in America, said, quote, "We cannot support the bill that passed the House as drafted because of the expected decline in health insurance coverage and the potential harm it would cause to vulnerable patient populations." The American Diabetes Association said of the bill, it would give insurers the ability to charge people with pre-existing conditions, such as diabetes, higher prices for health insurance, and would allow insurers to deny people with diabetes the care and services they need to treat their disease. The American Association of Retired Persons has weighed in. And here's what they said. This bill would weaken Medicare's fiscal sustainability, dramatically increase health care costs for Americans aged 50 to 64, and put at risk the health care of millions of children and adults with disabilities and poor seniors who depend on the Medicaid program for long-term services and support. AARP is working overtime to notify Americans over the age of 50 and their kids that the repeal of the Affordable Care Act that passed the House of Representatives is a bad deal for seniors and their families. There's something else going on, too. For years, more than 6 years, Republicans in Congress have been shouting repeal and replace from the rooftops. And they voted more than 60 times to repeal the Affordable Care Act. They never liked it from the start. They put language into bills to make it more difficult for the Affordable Care Act to work, such as funding needed to make individual insurance markets work as intended. And then on his first day in office, President Trump signed an executive order directing federal agencies not to enforce the Affordable Care Act. The Trump administration cut the open enrollment time frame in half, making it harder for people to sign up for insurance, meaning fewer people covered, fewer people in the insurance pools, and premiums going up as a result. And the president to this day continues to make uncertainty in the insurance market. He refuses to say whether he will continue providing cost-sharing reduction payments that help 7 million Americans afford health insurance. Without the payments, insurers tell us that premiums will skyrocket 20% next year. Let me mention one other thing that had happened as part of this health insurance debate. We decided to make an historic change in health care in America. I've told the story repeatedly, and I won't tell it in detail, but it was Paul Wellstone, who sat right there, progressive from Minnesota, and Pete Domenici, who sat right there, a Republican conservative from New Mexico, who came together, these two unlikely partners, because they each had members of their family who suffered from mental illness. And they said, why is it that we don't treat mental illness like an illness? Why is it that health insurance just covers physical illness? And they were right. And they fought the insurance companies for years, and they won. And we put it in the Affordable Care Act. We said if you offer health insurance, you have to cover mental illness. My friends, it's time for us to step out of the shadows when mental illness was considered a curse and not an illness, and deal with it as something that can be successfully treated. Well, we put it in the bill, and most Americans would agree it was the right thing to do. There was another part of it, though, that slipped my attention, and now I know is critically important. It wasn't just mental illness. It was coverage for mental illness and substance abuse treatment. How important is substance abuse treatment in America today? Go to Maine, go to Iowa, go to Illinois, and ask the question, any problems with opioids, heroin, overdosing, death? Of course. And when you go to the rehab and addiction treatment centers and you ask people, how is your family paying for this care to try to rescue this young child in your family or someone who's been dealing with addiction, they say, well, they are either under Medicaid, the government insurance program, or their health insurance policy covers substance abuse treatment. Why? Because Wellstone and Domenici effectively included that in the bill. And now, under the bill that passed in the House of Representatives, an estimated 1.3 million Americans with mental disorders and 2.8 million who are seeking help with substance abuse will lose their coverage for treatment. It's no longer a priority under the Republican idea of giving you choice with your health insurance. Choice. So when you're a father buying health insurance for your family and you're picking out a health insurance policy and you have a choice, could you anticipate that that teenage daughter that you love with all your heart will one day face an addiction and desperately need substance abuse treatment to save her life? Did you think about that when you signed up for the right choice and the lower cost health insurance plan? I feel, many feel, this is essential when it comes to services and health insurance. The Republicans say no, it's an option. Take it or leave it. People who leave it and then need it find themselves in a terrible predicament. They can't provide the life-saving treatment that their kids and other members of the family they love desperately need. I see my colleague on the floor here, and I won't go any further other than say, why are we in this position when 10 days before the final vote on changing health care for 360 million Americans is in a proposal that no one has seen and no one has read and no one has analyzed? This is an embarrassment to this great institution of the United States Senate. that we are not deliberating on this measure, this life-saving, life and death measure, with the kind of respect that it deserves, with the kind of expertise that it deserves. My Republican Senate colleagues have said it well, Senator Murkowski, Senator Moran, and others. The Senate ought to do what the Senate was elected to do. Take up an important measure like this, read it carefully, debate it, amend it, bring in the experts, and don't move so quickly on it that you could jeopardize the health care of millions of Americans. I'm sorry that it's reached that point. If three Republican senators out of 52, if 3 of them will step up and say this is wrong, we need to do this the right way, a transparent way, a fair way, a bipartisan way. If 3 will step up and do that, then we can roll up our sleeves and do the right thing for America. Madam President, I yield the floor.